So, hello students, welcome to the next session of the pathology lecture discussion series, and today's topic of my discussion will be mainly focusing upon the leukemias. So before getting into the detailed description for the leukemias, I would like to emphasize on the fact that the entire blood component, the entire component of the blood cells, that is the RBCs, WBCs and the platelets, they are all formed inside the bone marrow. So bone marrow is the site where the synthesis of all the blood cellular components take place, and it is the site where the progenitor cells, that is the hematopoietic stem cells, are present for all the cellular components, whether it be the RBCs, WBCs and platelets. And the hematopoietic stem cells, what are present, they are pluripotent in nature. That is, they can give rise to two series of cells, that is the myeloid cells and the lymphoid cells. So the myeloid cells, the component of the myeloid cells, it is going to give rise to the precursors of the red blood cells, the platelets and the monocytes as well as the granulocytes, whereas the lymphoid series of the hematopoietic stem cells, it is going to give rise to the lymphocytes, particularly the T lymphocytes, the B lymphocytes and the natural killer cells. So in the condition of leukemia, leukemia condition arises due to a malignant proliferation of the myeloid series of the cells, that is the myeloid precursors what are present in the hematopoietic stem cells. It is going to arise, the condition of leukemia, the medical condition is going to arise when the defect or the abnormality is going to occur in the myeloid series of the cells. So there is, the word leukemia can be split into two parts. Leuk means white and emia means blood. So whenever there are going to be presence of a large number of white blood cells in the blood, is the condition what is called as the leukemia. And the one line definition for leukemia can be defined as that leukemias are a group of disorders arising from the malignant transformation of the hematopoietic stem cells. So whenever there is going to occur a malignant transformation of the hematopoietic stem cells, this will lead to the formation of a large number of immature white blood cells, that is an increased number of white blood cells in the plasma, in the blood or the marrow spaces, or in both. So whenever there is going to be an increased number of WBCs in the blood and the marrow, or in the blood or in the marrow, this condition of the malignant transformation of the white blood cells is called leukemia. So it is particularly a myeloproliferative disorder because the hematopoietic stem cells, what are pluripotent in nature of the series of the myeloid series, leukemia is a condition what occurs due to the abnormal, the malignant transformation of the myeloid series of the cells. So this was the condition for leukemia, the definition I have discussed. And one thing what I would like to emphasize, that it is a kind of a there in the on in seeing the comparison between the acute leukemias and the chronic leukemias. So in the cases of acute leukemias, what we find is that in the peripheral blood smear, when we are going to see in the cases of acute leukemias, there are presence of immature WBCs, that is the immature leukocytes, are found in cases of acute leukemias. While talking of the chronic leukemias, the white blood cells what are present, they are partially immature. They are partially mature. So in cases of chronic leukemias, the condition what is in contrast to acute leukemias, that in cases of acute leukemias, the WBCs what are found in the marrow or in the blood, they are lacking maturity, they are immature, whereas in cases of chronic leukemias, the WBCs what are found, they are partially mature. So today's topic will be mainly discussing about the chronic myeloid leukemia, which is also called as the chronic myelogenous leukemia. The word myelogenous is getting into the term just because it is a proliferative disorder of the myeloid series of the cells. So the chronic myeloid leukemia, when looking at the predilections and the number of patients what are afflicted, so 1/5 of all the leukemia patients, they are of the chronic myeloid group, and this chronic myeloid leukemia is going to manifest usually during the third and the fourth decade of life. That is, during the third and the fourth decades of life, it has been mostly found that the patients who are suffering from chronic myeloid leukemia. When looking at the etiology, so the etiology of the chronic myeloid leukemia can be seen as we have already discussed, that since it is a myeloproliferative disorder, so there is going to occur the malignant transformation of the pluripotent stem cells, the hematopoietic pluripotent stem cells, and this is going to lead to a large number of immature leukocytes or the partially mature leukocytes in the blood. So the underlying chromosomal abnormality, the etiological factor, what comes into play, the striking distinguishing feature, what I would like to emphasize, that the underlying chromosomal abnormality is occurring at the hematopoietic pluripotent stem cells. So the chromosomal abnormality is occurring at the hematopoietic stem cell level, where the Philadelphia chromosome, that is the short arm of chromosome 22, is going to occur with the condition what is called as the reciprocal translocation. So the reciprocal translocation is going to occur between the chromosome 9 and the chromosome 22, where the arms are getting exchanged, and this Philadelphia chromosome, it is the striking distinguishing feature what is found in cases of chronic myeloid leukemia. When looking at the other etiological factors, such as there can be a genetic cause as well, and there are cases where it is found that the chronic myeloid leukemia is mostly manifested due to certain kind of an adverse effect of the ionizing radiations. Moving on to the clinical features. So when looking at the clinical features from chronic myeloid leukemia, since chronic myeloid leukemia is a slow progressive disease, and the symptoms what are usually manifested, the initial symptoms are usually non-specific. So the conditions, for example, the symptoms what the patients mostly complain, that is the easy fatigability, the weakness and weight loss. Moving on to the next clinical feature, the striking distinguishing feature what I would like to emphasize over here, that is the first symptom sometimes is a kind of a dragging sensation in the abdomen. So a dragging sensation in the abdomen is caused due to an extreme splenomegaly. So these immature WBCs what are coming excessively into the bloodstream, they are spilled into the bloodstream, and they finally go and block into the they go and accumulate in the spleen. So this leads to the splenomegaly, and thus whatever the normal cellular components are there, they are pushed apart, with the large number of immature WBCs lying spilled in the blood circulation. So there is an extreme splenomegaly, and this extreme splenomegaly is responsible, it is the first symptom what is mostly seen in the form of a dragging sensation in the abdomen. So other clinical features can be looked upon as, that is the weight loss, the lassitude, the anorexia, the night sweats, pallor can occur, dyspnea, the patient can have difficulty in breathing, pre-epicism, that is the painful penile erection, and frequent, the patient is predisposed to frequent infections, since the WBCs what have a role in fighting with the infections. So when the immature WBCs, and that too the count of the WBCs is more than 1 lakhs per cubic mm. So these immature WBCs are unable to ward off the infections, and the patient may manifest. Frequent infections can be seen in the patients who are suffering from chronic myeloid leukemia. Moving on to the peripheral blood smear. So on examination of the peripheral blood smear, what do we find is that the WBC count is usually greater than 1 lakhs per cubic mm. So the normal WBC count ranges from 4,000 to 11,000 per cubic mm, but in the condition of the chronic myeloid leukemia, this count excessively increases to more than 1 lakhs per cubic mm, and that too the WBCs what are formed, they are immature, they are partially mature. So the circulating blood cells are predominantly the neutrophils, the metamyelocytes, and the myelocytes. So students, in the proliferation, in the sequential maturity of the WBCs, the myelocyte and the metamyelocytes are the progenitor cells that actually give rise to the WBCs. So in the peripheral blood smear, what the cells what are predominantly found, it is the neutrophils along with the myelocyte and the metamyelocytes. Along with, there can be seen the basophils and the eosinophils are also prominent in the peripheral blood smear. So a typical finding, what I would like to emphasize, that there is thrombocytosis, an increased number, an abnormally increased number of megakaryocytes what is synthesized in the bone marrow, and this the increase in the excessive number of the progenitor megakaryocyte, which is the progenitor cell for thrombocyte. So it has been found, the typical finding, it is in the form of thrombocytosis, whereas when looking at the bone marrow investigations, so the hypercellular bone marrow is found. So this hypercellular bone marrow, it is actually due to the malignant transformation of the hematopoietic pluripotent stem cells. So the bone marrow, what is mostly seen, it is the hypercellular bone marrow as a result of the hyperplasia of the granulocyte and the megakaryocyte precursors. So the megakaryocyte, the thrombocyte, the megakaryocytes are the precursor or the progenitor cells for the thrombocytes. So since there is a hypercellular bone marrow, so the megakaryocyte precursors and the granulocytes cells, they are showing the phenomena of hyperplasia, that is an increase in an abnormal amount these granulocytic and the megakaryocytic precursor cells. So students, this was a short discussion about the definition, the etiology, the clinical features, and the peripheral blood smear findings of the chronic myeloid leukemia. Students, if you do have any queries or comments, you're most welcome to comment me in the comment section. And if there are certain topics what you want that I should discuss, you are most welcome to comment me in the comment section. For the students who are visiting my channel for the first time, and if they haven't subscribed yet, please go do and subscribe, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.